2.5 years ago, I think I was listening to some loud music, and the tinnitus didn't dissipate. It sort of stayed longer. So I got a bit worried about it. And I think over time, I probably didn't realise I was losing some hearing. So I just looked it up on hearing loss and tinnitus, and Swiss Medica came up. I read the article and it was very comprehensive and it was straightforward. I could understand all this, and I thought I could relate to this. The service is excellent, and you get picked up from the airport and brought to a room, and the food and the consultation. So all of that has been excellent.
Hello there and welcome to
Thank you.
Swiss Medica. Would you please be so kind to introduce yourself to our viewers and tell us what brought you to Swiss Medica?
I'm known here as Mr. Philip, and what brought me here was tinnitus. Yeah.
For the people who've never heard of tinnitus, how would you describe your symptoms and your everyday life with that diagnosis?
Well, probably the best way to describe it is if you go and listen to a loud band when you're young, and you come away and you've got this sound in your ears, and it generally dissipates over a day or two. And I think if you continue to do that, you can cause some hearing loss. And I think over time, I probably didn't realise I was losing some hearing. I was losing the high notes, not picking that up. And so about 2.5 years ago, I think I was listening to some loud music, and the tinnitus didn't dissipate. It sort of stayed longer. So I got a bit worried about it. So I went and had a hearing test, and they showed me that you probably damaged some cochlear hairs in the ear, and it sort of had a sound like, out of my left ear particularly, sounded like water flowing out of my ear. And but over time, that was like 2.5 years ago. Over time, I've been very careful. When there's loud sounds, I've been wearing earplugs to protect my ears, and I think things have calmed down. It's only when you get stressed that it happens, it brings it up. But so it's been pretty good. I can't hear any tinnitus now, but when I go to bed and everything's meant to be quiet, then you hear this sort of sound, which is a little bit off-putting when you're trying to go to sleep. So
is that what bothers you the most? Is that
yes,
what's the most difficult about?
Yes, because some people that have had loud explosions in their ear, and they get a sound very loud, but I can't hear that. But I might hear it finely when I try to go to sleep. It's sort of a very small sound. Now, maybe, I don't know, it just annoyed me. Someone else may not worry about it. So I just looked it up on hearing loss and tinnitus, and Swiss Medica came up, and there was a paper on what is hearing loss, talked about stem cells for hearing loss and tinnitus. So I read the article and it was very comprehensive. And it was straightforward. I could understand all this, and I thought I could relate to this. And so what I did was, after I read the article, I made a telephone call, and no, I think I put something in the, I don't know, in
Message or
a message, that's right, and then they telephoned me. I was quite surprised that this telephone came all the way from Switzerland. So I talked about it, and they said you can talk to our doctor about it. I did a Zoom, and I asked all my questions, and then I had more questions. I think I did about 3 or 4 different Zooms to make sure that I understood what happens, and some of the terminology which I didn't understand and what it meant. And we talked about the infusion, the IV infusion, and the local stem cell injections, which is in the tissue around the ear. So, and it said here, what can I expect? Improvement and different things. So I listened to some testimonies, and of course there was lots of other testimonies for other diseases and things. So, and it talked about the type of stem cells, etc. So I thought I would go ahead with it.
You traveled all the way from different parts of the world to Serbia. Did you have any kind of apprehensions or doubts maybe before coming here, and did you have to overcome them somehow?
No, I was determined to come here. I was, you know, you can hear negative things, not about stem cells. You know, I think there's stem cell treatment all over the world. But I liked what Swiss Medica said, because I read the paper, and it sort of zoned in on what I was looking for, was the tinnitus. So I was more determined to go ahead with it.
What are your expectations or hopes for the post-treatment?
Well, what I'm hoping for is that it says here that it's regeneration of the tissues and the cells, and I looked at the healthy and damaged hair cells in the ears, and it says about the regeneration of hair cells. So I was a bit concerned whether my cochlear hairs were dead, or were they just damaged. And I think we did a test, and I did a hearing test, and I think we looked at it, and I sent it to the doctor in Switzerland, and mentioned that it was more likely to be damaged. There might be some dead ones, I don't know, but so I thought I'd come to have those damaged, it says the damaged hair cells, they can, I think what it says here, it says transform into the cells required to produce a tissue to restore it. So I was interested in that. So I'm assuming that over months that it will there'll be regrowth or regeneration, yes, of those cochlear hairs. Yeah, because it's the hairs that if they're damaged, I think that's what it sends a signal to the brain when everything's very quiet. It makes its own sound.
I may ask, from initial contact with Swiss Medica to coming here for the treatment, were we according to your expectations? Can you share with us your general experience overall?
My expectations?
Did we meet your expectations here at the clinic, while you were traveling from other parts of the world? If you can tell a few words about service for people that might watch this and they are skeptical. Is there a clinic? What kind of treatment I'm going to receive? How would you rate it? Or describe it?
The service is excellent, and you get picked up from the airport and brought to a room, and the food and the consultation, and you have your own you have nurses and doctor, and they prescribe when the stem cells, when they the type of stem cells you're going to have on what day, and you do some therapy and different things like that. So all of that has been excellent. But at this stage, I've only started having the stem cells, so I think I've got to give it time for the process to work, because it says here, it takes like one to 3 months or something. But once it starts the process, it can even when that passes out of the body, the stem cells, the process can still be healing, and so that's why I'm going from what I've read. So I'm trusting this.
Trusting the process. Let's put some trust in the process, of course.
Yes.
For the last question, we always like to ask: would you have any kind of advice or an insight that you would like to share for people that are suffering from same or similar condition as you are?
Well, I think from what I've heard, not one tinnitus fits all. Everyone has a different sound, a different experience. So it's a little bit hard. I think mine is because of the high-pitched notes that have sort of been damaged, maybe, in my ears. Of a night time when things are quiet, my brain is making this sound, I think, to compensate for it. So, which I found annoying. So that's why I want to do something about it. But someone else might have, I don't know, it could vary with...
Did you feel that everything was safe here, that you were in the good hands?
Yes.
No scary needles or knives or something like that?
No, I understood because I read all about it and the injections and different things, so I knew what was coming. So there was what I was expecting has happened, and so there was no fear.